Unfortunately, if it is left untreated, it increases your risk of serious problems such as heart attacks and strokes. The NHS advises all adults over 40 are advised to have their blood pressure checked at least every 5 years. It's not always clear what causes high blood pressure, but there are things that can increase your risk, and a number of drinks and diets that may help lower your blood pressure. There's good news for tea lovers. Indeed, studies suggest that certain teas may help reduce blood pressure. The long-term intake of black tea and green tea types can lower systolic and diastolic blood pressure. The reduction in blood pressure has been found to be more significant for green tea. The systolic pressure is the force at which your heart pumps blood around your body, while diastolic pressure is the resistance to the blood flow in the blood vessels. Dementia warning: the popular vitamin supplement that increases Alzheimer's risk. Avoid both prune juice and pomegranate juice may also help people suffering with high blood pressure. In one study, published in the National Library of Medicine, researchers found a significant reduction in blood pressure among people who ate a single dose of 3 prunes per day. In another study, researchers reported that consuming pomegranate juice may help lower both systolic and diastolic blood pressure. If you add juices into your diet, you should make sure that they are not high in additional sugar content, as this could be bad for your health. Dementia, the mineral that slows brain decline, tips fatty liver disease, signs your liver is struggling, insight hypertension diet, the 2P snack that lowers blood pressure, tips. The NHS says, making healthy lifestyle changes can sometimes help reduce your chances of getting high blood pressure and help lower your blood pressure if it's already high. Diet is one of the most effective treatments for high blood pressure. Some people with high blood pressure may also need to take 1 or more medicines to stop their blood pressure getting too high. As many as 5 million adults in the UK have undiagnosed high blood pressure, so will not know that they are at risk, according to the British Heart Foundation. Indeed, a third of British adults have high blood pressure, according to Blood Pressure UK. However, this warning sign doesn't have any symptoms, meaning many Brits are walking around every day with no idea the danger they're in, as their blood pressure continues to skyrocket. The only way of knowing whether you have high blood pressure is to have a blood pressure test. If you are overweight, a smoker, or have a family history of heart disease, you are considered at risk for high blood pressure and should have it checked once a year. The NHS has outlined some other lifestyle changes which can help prevent and lower high blood pressure. It says you should reduce the amount of salt you eat and have a generally healthy diet, cut back on alcohol, lose weight if you're overweight, cut down on caffeine, and if you are a smoker you should stop smoking. The Health Body says, blood pressure readings between 120/80ths of a millimeter of mercury and 140/90ths of a millimeter of mercury could mean you're at risk of developing high blood pressure if you do not take steps to keep your blood pressure under control. Nonetheless, having a raised blood pressure reading in one test does not necessarily mean you have high blood pressure, as blood pressure can fluctuate throughout the day.